Welcome to the final part 6 of No Pain, More Gain. Today we're talking about how a physical therapist treats pain. Now we saved the best for last, so let's get into how a physical therapist can actually treat people with pain depending on which bucket they fall into and leave them with a positive experience. This video is going to be split up into 2 parts, but I'm not going to make you go to a new video. Both parts are in here. But the first one is exercise. I've all heard that physical therapists specialize in movement, and this is when we actually get to put it into practice. So we've already screened for the patient's red flags. We've decided they don't have any, so now we can actually get started with our modalities. Exercise in general is fantastic for decreasing pain, specifically aerobic exercise, but honestly, whatever the patient enjoys. Adherence is the main key here. If the patient won't adhere to their exercise program, especially when they're at home and you're not there to watch them, they're going to have trouble making progress. So it's really important to set an exercise goal on something they enjoy. Do they like hiking outdoors? You're going to set an exercise goal towards hiking outdoors. If they like to be in the gym, you're going to make an exercise goal related to the gym. By completing an exercise program, it will help to reduce stress. Stress can affect your mood, your breathing, pain, your sympathetic nervous system, and your muscles. By starting exercise, we can aim to combat that. We can also focus on manual therapy, relaxation. We can refer for their nutrition, and help with sleep education. By incorporating a blend of aerobic exercise, resistance exercise, postural exercises, stabilization exercises, we can treat the patient in a holistic way. Not only are we helping to desensitize their pain and reduce stress, and help from pain reoccurring in the future. There are so many things that exercise are good for. Things like improved firing of neurons, regulation of cortisol, improved mood. You can go on for a long time. And it's important to stress that to your patient. Education is crucial for treating pain. So how can we get patients to stay with their exercise program? Well, we already talked about making it personal, but we can also help them track their goals. Things like using a logbook or an app to track their progress helps patients see that they're actually making real gains and they'll want to continue doing that. Also, if they're not into going to a gym, make sure that the exercises that you're giving them are ready available even at their home. Things like body weight exercises or using a chair is a great idea. Also, try to plan a time of the day with your patient that they're going to complete these exercises. They found that patients that set aside a designated time throughout their day have way more compliance to actually completing their home exercise programs. Part 2, you can also complete graded motor imagery. So what is graded motor imagery? Well, I'm going to explain it to you the best way that I would explain it to an actual patient. Think of your brain as almost a map. Well, when you fall into bucket number 3, the central bucket, the map on your brain is smudged. So we need to wipe off that smudge. We're going to complete different modalities in order to erase that smudge. First, we're going to complete laterality testing. Now that just means discriminating your right from your left. Next, we're going to complete localization testing. We'll use things like 2-point discrimination, which is when we take 2 little pinpricks, and for example, we'll place them on different parts of their back. The goal is to feel if there's 2 or 1 pinprick touching your back. This will help to localize where you're feeling each touch, hence helping to wipe away that smudge. This sensory discrimination will help us to understand, am I feeling this in my lower back or my upper back or both? Again, providing that sharper image for the map. Lastly, we're going to complete mirror therapy. Mirror therapy is when you cover one hand from the back of a mirror, and then your other hand is on the mirror side. It gives the illusion that both your hands are in view, or legs if you're targeting legs, when really one arm is hidden. Then when you move one limb, it seems as if both are moving. It's almost tricking the brain into thinking there's movement when there actually isn't. Again, helping to wipe away that smudge even more. Also, modalities that we already talked about, like manual therapy, can be a great way to help with the central bucket as well. It's very important when completing graded motor imagery to educate your patient, though. If they feel like they're doing useless tasks, it's really hard for them to make progress. By providing great education without making them feel like it's all in their head, like we talked about, you can increase compliance. This is where that internal locus of control that we talked about in the other video is very important. When they have the outlook of what differences can I make and what goals can I achieve, graded motor imagery can really be used well. So let's recap. What can a physical therapist do to help with someone in pain? Once they put their pain into one of the buckets, they can use exercise, sleep education, relaxation, manual therapy, sensory techniques, and graded motor imagery to help calm the nervous system and target the pain depending on which bucket they fall into. With the proper education and modalities completed, and that patient being in an internal locus of control like we talked about, the patient is set up for success. They can reach their goals and use a physical therapist can provide quality treatment. Thank you for watching No Pain, More Gain. I hope you learned some awesome stuff on how you, as a future physical therapist or current physical therapist, can help your patients to reduce or even eliminate their pain.